Hello, my friends. I have a really, really fun guest today. I was on Dr. Jannine Krause's podcast about, a couple, 3 months ago or so, and it was the favorite podcast interview I've ever had. I had so much fun being her guest. I don't know what it was, but something about her personality just lights me up, and she's just fun. So I know you're going to love her. And our topic today is wonderful. We're going to be talking about acupressure points for pelvic pain and tension relief. And she is a naturopathic doctor in the Tacoma, Washington area. So Jannine, can you, first of all, I'm really curious about your experience with acupressure and acupuncture, and I can tell you briefly about mine, if that's okay. Maybe I'll let you say hi, and then yes, hi, and I'm going to go ahead and just keep talking because that's kind of what I do. I can go forever, but my experience with acupuncture, not pressure, because I actually don't have a lot of experience with acupressure, which I'm excited to talk about today. But with acupuncture is I've actually had definitely successful relief from pain, from some back pain. So I have minor experience with acupuncture, but I will say, I'm going to just be really honest here, it kind of hurts. And it wasn't always the most pleasant experience for me. Maybe I'm just a baby. I'm not really sure, but it was a little bit painful. And, I think that's part of the process. But that's one reason I am really excited to talk to you about acupressure, which is not involving needles. That's my experience. Tell me a little bit about your experience and also some of this recent training that you did.
So yeah, as an acupuncturist as well, I definitely, sometimes there will be points that hurt, but it shouldn't be that painful. Here's the thing, a lot of people, if we're working with back pain or we're working with pelvic floor issues, you want to be using the most mellow needles because we've got trauma there. And if you add more trauma, now someone's going to tighten up even more. So my goal when I'm working on folks in the office, I'm definitely trying as much as I can not to have that pain response. Yeah. Because traditional Chinese acupuncture, in an essence, a lot of people are going, well, it should kind of hurt because the qi feels like pain. It feels like achiness. But let's put it this way, our American bodies understand it as pain and trauma, not as qi. Many of us didn't grow up having acupuncture. So having this sensation, it's like, oh, this is painful. And I've had acupuncture like that. I've even done it to myself and been like, oh man, that's awful. So when someone's working with you, you need to have someone, and then this is just in general for everyone listening, you need to have someone that is really understanding of trauma, and understanding a gentle needle can go a long way. You do not have to torture people. Plus, sometimes if it hurts, you've got it in just the wrong direction, just a little bit. Because I joke with folks, we have a margin of error of millimeters when we're working with individuals, because everyone has little tiny nerves and little tiny capillaries that we're trying to get around when we're putting the needles in. So being really great at your anatomy is what is going to help. And so looking for an acupuncturist who's done advanced training with anatomy, or someone who's even taught anatomy and physiology. That's one of my backgrounds, is I was a professor for 5 years, and just as much as I could get in with cadavers and see and understand what's underneath that skin, it makes a huge difference. So interviewing your acupuncturist, doing your homework on the folks, that's going to help you to go a long way. And my recent training was a sports medicine acupuncture certificate. It took me 18 months going through all of the different ways of needling and techniques and anatomy, a ton of anatomy. And so looking for someone that is certified in sports medicine acupuncture can be helpful. Now you might be thinking, well, if I have pelvic floor pain, why do I want someone that's a sports medicine specialist?
Well, I was just thinking that's fantastic that they even addressed that they talked about the pelvis, because of course that's the crux of our body. It's the powerhouse of our body. So I'm not surprised they did, but at the same time, I find that so many times it's glossed over, but obviously you had a great training.
Yes, yeah. The guy who's in charge of, his name's Matt Callison. He did some extensive work with pelvic floor PTs because it is an area that's overlooked. And now that I've been needling and I've practiced on the proper needle techniques, I'm seeing some really great results in folks that have had back pain and pelvic pain for years. Nobody could really get a hold of it. And then now it's like, oh my gosh, I feel so open in my pelvis. I feel so different. I feel floaty. A lot of people come off the table like, there's the acupuncture high and then there's the pelvic floor acupuncture high is what I've called it. Like they're like, and like moving around. I had one guy dancing. He's like, I've not been able to move like this in years. So there's some really cool stuff. Now, in the realm of where we're recording this, we are deep into the social isolation and COVID. And now I have some people who I was working on that I can't bring in because they're in an older age. I'm worried about them. I don't want them to come in and have any possible, contamination. So this was timely because now I'm teaching folks how to do acupressure for the pelvis to help to release the muscles on their own.
Yay. And I'm so excited about this because you're going to show us some techniques, aren't you?
Yes, I am. Yes, Woo! I am. I'm also going to show a little bit of some of the connected muscles because we're not just the pelvis. We're not just the back. We're not just a foot, a leg. It's all connected, whether you like it or not. And some days it frustrates me that it's all connected.
Oh, yeah. Chasing symptoms, anybody?
Like ding, 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 ding. I like to joke with my patients in the office. There was Pee Wee Herman. Do you remember Pee Wee Herman?
Oh, yeah.
He kind of got a bad rap, but back in the day, man, his song "Connect the Dots," la la la. I will sing that in my office to my patients when I'm trying to figure the things together, and everyone's like, "Ooh, Pee Wee's creepy." I'm like, "It's okay." This is before we knew he was creepy when that song came out, so it's cool. We can use it. Oh man,
I love Pee Wee Herman. This dates us a little bit, but I'm totally okay with that.
Yeah, I mean, back in the day, him and Cherry and the Connect the Dots song, I mean, I live by that. Them and Mr. Rogers, all the cool people.
It's why you got into anatomy, isn't it? You never know.
I mean, it is. Mm-hmm. Yep. I was just, in a non-creepy way, I'm trying to get out that anatomy desire to teach everybody what's up. Oh my goodness.
I love it. Okay, well, perfect. So let's go ahead and connect some dots and talk about how we can do this at home and well, first of all, I guess we should say, what is acupressure? Is it basically acupuncture without the needles?
More or less, yeah. I change it a little bit to tweak it to what's comfortable for folks because if you watch any of the acupressure gurus, they're telling you about depth. They're telling you about how many circles you have to do clockwise or counterclockwise. My head spins.
Yeah.
Like, let's date ourselves again. If you remember the movie Beetlejuice and the head shrinks, that's how I feel. Like my head shrinks and spins. And they're like, you need to press in at this depth. And then after you press in at that depth, you have to do 6 directions this way and 7 this way and 9 this way. And then, snap your fingers. It's too much. And most people are like, I can't handle this. And I'm definitely one of them too. So I've simplified acupressure to just pressing in as if you were going to press a doorbell. So that same amount of pressure that you would press a doorbell, which gives, yeah, you're kind of going in like you're doing. You went right to the amazing pericardium 6 point for
Look at me.
Yeah.
Man. Good
you
for
just
me.
up right now. So this is an anti-nausea point, but it's actually a really great point for opening up the core. So this point here, for a lot of folks, you put your knuckle on your wrist crease and where your finger touches right there, this is anti-nausea. Put your C-bands here if you're going to get out and travel, if you're not afraid to get on a cruise ship once things open up.
Yeah.
But this is P6, pericardium 6. It has to do with anxiety, has to do with nausea. So if you get nervous and you get pukey feeling, this guy's great. It can also help with the pelvic floor if you combine it with a point on your foot, which seems super weird.
Wow.
But here too, I'm going to take my sock off for this situation.
And so how long do you have to put that pressure on? Is it like a minute?
It can be like I do 30 seconds to a minute. And oftentimes I'll kind of go back and forth between the two spots. And so I kind of will do like 3 rounds or so, just because 3 rounds seems to get the trick, kind of get things moving. I feel like I've calmed. I feel like, because this point's also a very calming point once you kind of breathe into it. Now that's the other secret that I found about acupressure is breathing. Once you hold on to that spot, there's that, and so 5 count inhales, 7 count exhales. And doing that, for the 30 seconds to 60 seconds, depending on how ADD you are or how much time you have, 30, 60 seconds. Then you're going down to your foot. And in particular, you want to use your opposite foot. So left arm, right foot.
Okay.
So with the foot, I'm going to scoot in a little bit here so you can see. We've got the big toe, and then we've got moving down. And you have this bone right here that comes as your first metatarsal. You're going to feel like a lump. It kind of slides right to a lump. Right there is spleen 4. This, you would think is weird, like spleen and pericardium. I'll explain here in a minute. This point connects with this point. So I will hold this guy for 30 seconds to a minute. And you can rub it if you want. If it's kind of sore, rub it. Go for it. Whatever feels good. You don't have to worry about how many directions you go one way or the other. So doing these 2 points, what it's doing is opening up something that the Chinese call the sea of blood. And what the sea of blood is your core. So all of this area, here to here, by using those points. The theory is that it's actually helping to descend some of the stuff that's stuck here and open up your diaphragm. Okay. And by doing it, you're grounding kind of crisscross. If we think about myofascial connections and the X's here, it's kind of one of those ways to just get the body to connect this way. Okay. Now, if I do it this way, I do it this way too.
I was just going to say, so you would do your, say, left, wrist, the pericardium point, and then your right foot spleen point. Okay, gotcha.
Yep. And spleen, a lot of people might be going like, why spleen? What is that? So in the Chinese world, when we were translating everything, spleen and stomach are digestive channels to the Chinese kind of hierarchy of explanation of Chinese medicine. And the spleen ends up being one that helps with nourishing the body, getting blood flow moving, also strengthening blood, as they would call it. And I think if I translate it and how I see the channel working, it seems that what it does is help kind of put a little fire under the body to get blood flow to move a little bit better. Wow. So you'll hear me talking a lot about blood flow today because there's most of the points we're going to use are going to be ones in that category, moving blood flow, but also motor points. So these are trigger points that happen to be acupuncture points too.
Okay, I'm loving this so far. So basically we're starting to open up through the, center of the body and getting the flow happening. And that's our warm-up point with the pericardium and the spleen. And so that's something you want to do before you kind of hone right in on the pelvic area.
Yes, you're telling the body like, okay, we're getting things moving here. So we're going to start with those. There's 2 more that kind of go directly to the pelvis. Okay. So in Chinese world, and I'm going to say this a lot because I think a lot, I don't know, maybe I might get repetitive. You can tell me if I'm saying repetitive too much. But in the Chinese world, we also have these, if you will, channels that develop when we're inside mom. Okay. And they're called the 8 extraordinary vessels. And that sea of blood is one of them. The other one is called the Dai Mai. And the Dai Mai is our girdle vessel. So literally, it's our pelvis. All this right here is known as the Dai Mai. And the way we tell the body we're going to open up the Dai Mai is we have something called Sanjiao 5, which is a point completely on the other side, more or less, than this guy, the pericardium point. So same kind of thing, stick your knuckle here, where your finger goes. You're going to want to go a little bit closer towards your radius bone, which is the bone that's towards your thumb side. And it's right in there. And really, you can't mess this up. Your finger is big enough that you're going to cover the spots. And go a little bit more lower. Yeah, there you go. A little lower. Yeah. It should be sore. Sometimes
feels tender. It feels a little tender there.
Sometimes it's a little sore. Sometimes you'll also find that if you slide down, there's almost like a divot or a sticky spot. And so play with it, you guys. It's kind of fun. Your body will tell you where these spots are.
Ooh, I like that. It's a good tender. It's like, oh yeah, this needs something. I don't know what this means, but I like it. Okay, I'm liking this. Don't mind me. I'm just...
Yeah, and sometimes this one will too. I mean, these are impressive. These are impressive points. So you got this guy here. This is Sanjiao 5. Sanjiao is water transport within the body, but it's also the connecting point for your daimai, which is your pelvis. So we are going to match this guy with another one down on the foot. So back to the foot. So you get an exercise with this. Opposite side foot, yep.
Opposite side foot, okay, okay.
And I'm going to turn a little because I think, yeah, there we go. That'll look better. Don't get my head on this one, but you get my foot. Okay. So you've got your pinky toe here, and wiggling the pinky toe, you're going to bring up a tendon here. I don't know if you guys can see it. Can you see my, yeah, there we go. Yep. This tendon, that last one there. And out to the side of it, you're going to find like a little divot in there. And it might be kind of sore too. And it's right.
Yep, I feel it. Right there. A definite divot.
So that is gallbladder 41. And so that guy connects this guy, this guy here, Sanjiao 5, to gallbladder 41. That opens up your pelvis. So those are kind of like your 4 primer points to tell your body, like, this is what we're doing. We're going to open up the blood flow through the whole core, and we're going to open up the blood flow through the pelvis.
Wow. So would you, if somebody was doing this at home on their own, because again, this is safe for people to play with, right? Are there any contraindications or precautions that people should know about?
If you're pressing and it's so sore, maybe you want to lighten up a little bit, because I know some people will get really aggressive with it. Keep in mind the pressures, if you give it in a little bit, so this is what it should look like. So I'm pressing just a little bit in. If you're like, and your finger's hurting and it's shaking, you're pressing too much. Kind of come back a little bit. But really, yeah, you're not going to damage anything. If we were doing neck ones, there'd be a lot more contraindications because we've got huge vessels in here if you're compressing them. Yeah. When I talk a little bit about some of the adductors in the thighs, we'll make sure we stay away from the femoral artery, vein, and nerve. So here's like the contraindication. If you feel an artery or something going bloop, bloop, bloop underneath your finger, move over from it. Don't compress it, because we don't want to be messing with those guys too much. Okay. And yes, pressure is a big deal. You know, if it feels like your hand's shaking because you're pressing so hard, you're pressing too hard. It's literally like you're just kind of gripping a little bit. And you can see me divoting in. But yeah, good question.
So you would do maybe both sides on the feet, and then both sides on the back, and then the corresponding. Okay, perfect. Got it. So we've opened things up.
We've opened things up. Now we got to go to the real deal, like getting into the business there. So I'm going to scoot back a little bit and talk a little louder. And before I do that, I got a dog hair on me. Move that off. My dogs come down here all the time. So those of you who might be fans of golden retrievers, I've got a golden retriever for everywhere down here.
I think we've all been there. Most of us have cats or dogs. We get it. No worries.
They're so great. They are. 2 things to think about before I scoot back. If we're looking at sinews, and meaning like tendon and ligament and things of that nature, in the Chinese world, when we're thinking the pelvis, we're thinking gallbladder, we're thinking liver, we're thinking urinary bladder, and kidney. So we have 4 main kind of areas to think about in that department if we're kind of going, what's wrong with the pelvis? And so in an acupuncturist office, I would be going, is it liver? So someone's really stressed out and they're on lockdown in the pelvis. Do I need to really work hard on that liver? The cool part about the liver, its best friend is the gallbladder. So these are the folks who have like one hip up higher, so elevated ilium. So for those of you out there that are not familiar with that, here's my pelvis a little bit. If we have one hip like up like this, a lot of people can resonate with having one hip off and twisted, things of that nature. So that would be a liver, kind of a gallbladder-y pattern. So someone who's stressed, maybe you have a repetitive job and that does that, or you have some weakness that you're running and the pelvis is coming up. So I'm sure you've seen people like that before.
Oh yes, for sure, for sure. In my head, I'm wondering, would scoliosis be, I mean, I know that's a mechanical, structural thing. Is that associated or totally different?
Well, in that case is where we kind of get some overlap, maybe, I guess you could say, because anything with the bone in the Chinese world, so say you were born physiologically with scoliosis, or you're born physiologically with a femur that's shorter, one shorter than the other, or something of that nature. Anything that's related to bone is going to go to kidney as the core. We might see manifestations of liver or gallbladder. So what we'd end up doing with this person's going to have a little longer of an acupressure session is what's happening, because we would work a little bit kidney, gallbladder, and then we would do liver, and then we go to urinary bladder. So they get all 4 of them.
Yeah.
If it's like pure scoliosis and we've got some back and pelvic pain, but we're not looking at anything elevated or twisted, then I would be going down the lines of we would do kidney and urinary bladder. Okay. However, as I say that, I don't really know anyone that I've seen that's had scoliosis that doesn't have an elevation. So if it's maybe higher up and it's pure back pain, then I would be just straight urinary bladder and kidney channels.
Yeah.
And just a little background on urinary bladder, kidney channels, just so folks can kind of see what's up there. Liver stress, the Chinese believe if your liver's not moving well, you're stressed. And usually when we are stressed, we're drinking wine, we're drinking beer, we've got a venti latte each morning. There's lots of things that are going to be hard on the liver. Maybe we're not eating so well. Now, gallbladder is its paired channel. It's connected to it, so that kind of goes along for the ride. Now, kidney, this is when we're super tired. We're worn out. Perhaps we've had a lot of trauma in life. And you can take it as any abuse, or you could take it as many things that just happened that sucked in life for you. I think we all have had traumas. It's all a matter of how much they've compounded for us. And kidneys also kind of related to adrenal glands.
Yeah.
So being exhausted, fatigued, that kind of stuff. In addition to looking at the bone side of things, any structural defects, any hip replacements, any knee replacements, any bone injuries, bone cancers, in history, stuff like that. That's kind of kidney. Also, just weakness, general weakness, feeling just down.
Yeah.
So that would be more the kidney. Urinary bladder goes along the same line, except urinary bladder is a little bit more superficial. So this would be more of like an injury. Say you pulled a hamstring and then your pelvis just never was the same after. Or you pulled the groin muscle and your pelvis was never the same after. Or a back injury and you were never the same after. That would be more in that case where you're not fatigued. You just have this pain that just won't go away. But I'm sure we could also argue that pain is fatiguing too.
Oh yeah, for sure. This is so fascinating. I mean, Chinese medicine is it's such a vast science. Such a vast science.
It is.
So basically you're starting then the liver, the bladder, and the kidney are all, you kind of are working on all of these points then when you clear the channels and then focus on the acupressure in the pelvic area?
Yep.
Okay.
We're working essentially on all of them. The deeper we go into the pelvis, the more it's kidney. The more superficial we go, it's more gallbladder, liver, etc. So I'll throw it out there as I'm going through.
Yeah, let's see some points.
Let's start with some basics that are more superficial, and then we'll work internal for the last part of this. And so, full disclosure for folks who are watching this, I am going to show you some pelvic floor points. So be ready for it.
Yeah. And
don't be no clothes removed, though.
Worry, we're just showing this is just real life stuff. We're not showing everything is with clothing. There's nothing crazy here. So let's go for it, girl.
Nothing crazy. Just me and my tights hanging out in my basement gym. That's all we got going on here. All right. So first things first, and I think I could probably do this one just a little bit higher up. So we've got our hip bones here. So you can get your hand in, you put your hands on your hips, when you get a little attitude there.
Little hip circles.
Yeah, hip circles. Exactly. Love the hip circles. And these guys are amazing for opening up something called gallbladder 27. This is your psoas coming down from T12, coming down, attaching into your groin here. Psoas makes a nice appearance across. You can find it by putting your hand on your hip, following with your fingers right down your bone, and then getting right kind of anterior. Usually it's pretty sore. This one I'm going to recommend pressing a little bit on because you can feel it when you get in a little deeper. Do you find that guy?
Yep.
I know you know who it is. Yep. Those of you who might be watching this and going, I've got a little bit extra weight. How am I ever going to find this? You'll be able to find your bone. Just ease your fingers in. Just roll it across. You'll find that sucker. You get in here, and with this guy, this is a little bit more pressure. Now, if you feel any artery, vein, or nerve, which you shouldn't, but for some reason, everyone has anatomical differences. Let's just keep that in mind. Move over just one way, this way or over this way. I actually prefer to move over laterally because we have something called the abdominal aorta. We don't want to be pressing too hard there. Usually you're going to have to press really hard to get there. So this is your psoas release point. It's gallbladder 27. You can use 2 fingers here. You also can take a tennis ball and press in here. I do not recommend, you probably see a lot of stuff online with the folks putting their like kettlebells, like 100-pound kettlebells on their pelvis trying to release their psoas. It's really popular in the CrossFit world.
Okay.
There's 3 organs in that area. Don't do it. Your intestines are all kind of right in here, and your colon comes down and goes this way. So stay over here, find your hip bone, kind of get in there, just follow the bone along, and then you're going to be right at the superior border of it, and you'll feel it's going to be a little sore. This is your gallbladder. 27 point releases your psoas. You can lay down and do this as well. You might find it better because if you lay down, you can find your hip bone sticking up when you lay down. But this spot's a great spot to start with here. And don't stress out. If you are out there and you're trying to do this and you're like, I don't know if I'm in the right spot, it's okay. Yeah. Just getting some tissue moving right in that area. So many of us are like stuck right there. A lot of people, sometimes it tickles a little bit, but if you're doing it yourself, it's not going to tickle as bad, and just easing into it. So just with that thumb, easing in, just kind of giving a nice little gentle massage there. I do gentle massage on this spot just because it feels better versus sometimes just straight poking in.
Yeah.
You can also use all 4 of your fingers and go into here.
Can you use, I was just kind of doing it with both fingers right now and kind of getting in there, and that's okay? Yeah.
Absolutely. Absolutely. I like it. Move back just a little bit. I want to see. Yeah. See, folks, right there. I like it.
It feels really good. And I mean, the fascia connects, it surrounds everything like a body stocking of tissue around everything. And so, like you said, we're not going to mess up. We can't mess this up because no matter what, you're going to be getting the tissues moving. And that's really, it's the motion is lotion concept with hip circles. You're just moving stuff and it gets everything. And so, yeah. Okay. This is wonderful. I love this point. And you said this is a gallbladder point. Okay.
Yep. Gallbladder 27 is its fancy name. There's a Chinese name. Don't even ask me to say that. I couldn't actually. It's not. I'm very bad at my Chinese. But yeah, just getting in here, and you can do them both. These are ones you could do at the same time as well. I think you could do these with hip circles. I really think we could put them in just like so. Find your bone, kind of go like this, and then hip circle it. Yeah.
I hope everyone's doing this with us right now. That's really wow. Especially when you go forward, you can really get in there.
Yeah. That, makes perfect sense. I feel it more on the right, so I'm going to do a little more. There we go. Yeah. So yeah, hip circles with this, totally. I love it. I think that icing on the cake.
Boom. Done. Well, no, not done. We have more. There's more. So what's the next one? This is great. What's the next one?
The next one could actually work with hip circles too, I think.
Okay.
This one is top of the hips. You can feel the hip bone here. And you're going to find your other bone, which is your greater trochanter. It's part of your femur. And halfway in between here, we've got glute minimus. It's our tiny little strappy guy that goes right like so. And so I think pressing on that in a little hip circles.
Oh yeah, that feels really good. Every time you go out, you're getting, that feels really nice.
Yeah, so you guys watch Bree. She moves better than me.
So just really steady pressure on that, huh?
Yep. That one is a motor point. So that's where the nerves come into your glute minimus. So if anyone's into geeks out on this kind of stuff, Janet Trebell, do you remember Trebell? Yeah, most people know that.
Yeah. Mm-hmm.
Trebell book is amazing because Janet was she was the PT for JFK. Oh, and she categorized so many trigger points. And so these are trigger points. So you can just hang out like this, doing some hip circles, and you're helping to release those guys.
That feels really good. That's such again, kind of a tender area, but like that good tender. So yeah, I think people will really, and you're getting an arm workout too while you do that. So multiple things. Okay, so we have our psoas, we have our glute medius, or whatever the Chinese name is for that.
No, minimus. Did I say? Oh, I might have said medius. Sorry, minimus to be specific. And then medius is back here. So you just set us up for our next one.
Perfect.
Medius. Perfect. Mm-hmm. So once again, put your hands on the hips, and you're going to find some lumpies back here. Those lumpies back here are your posterior SI joint areas. So there's some lumpies. Oh, she's going to get yeah. Get the pelvis for us. Perfect. Yes, those are the lumpies back there. So you get the lumpies, these little lumpies here, connected to your bone out here, which is your greater trochanter. You can see I've got like a line I could draw between them. Creep your fingers down this spot. It's called the gallia aponeurotica, fancy term for a line of tissue that gets gunky. Yeah, and see if you find an exquisite spot that's kind of sore. A lot of people, it's by the hip bone. So going more towards the greater trochanter. And then back to hip circles. Back to hip circles. Yeah.
It's great. Okay, I love it. Hip circle trigger point release. This is a whole new thing.
Yeah, you got to do a video on this. I want to see it because it goes well. Like, yeah. I actually do that. Honest, full disclosure, everybody, I love Dr. Bree's hip circles to the point that I do them with everything. And I did do that with this, and I was hoping she was going to like it.
I love it. I'm so impressed. We need to patent this.
Yes, for sure. So you get those guys, your glute medius, this guy, it's really, there's a strap literally of tissue that just from here, from the lumpies to the greater trochanter. So this is a wide range of area.
Yeah.
And that's okay. You can't mess it up because you're going to find what hurts. Yeah. You know what hurts. Yeah.
Okay. Yeah,
and you just get the hip circles with it.
Okay.
And like I said, you will find things that you don't even know hurt. You will find things that are sore. You'll be like, oh yeah. And if you find it and it's sore, it's the right spot. Don't second guess. Don't get too detailed. You find the spot, it hurts, put your fingers in it and do your hip circles.
And then maybe, so I think what would feel good for me, tell me if this, this is what you would do. But so maybe you do your hip circles, you're on your spots, and then you're like, oh yeah, there's the spot. And then you kind of hold it there maybe. Just hold it steady and kind of get in there and then maybe circle your thumb around. That's what I would tell people to do. Is that correct?
Absolutely.
Okay, good.
Absolutely. Heck yes. Do it. I love it.
Okay.
Yeah, and if your thumb hurts, do your fingers or do 4 fingers. Like you could do this too. I know sometimes for folks, thumbs get sore. Or if you don't want to use your fingers because they're sore, get a tennis ball. Get a golf ball. Mm-hmm. It works nicely. I didn't bring my golf balls, and I think the dogs took all my tennis balls, but you get the idea.
Yeah, that's perfect.
Well, I love it. You find a spot and just hold there. And just so like if say, let's go to the next spot because it's kind of fits in for kind of going straight into the booty area.
Okay.
So put your hands on your butt, like so, and your palms can be on those lumpy spots that we just looked at, the posterior, superior, iliac spine guys here. And where your fingers touch, see if you find something sore where your fingers touch. This area, right in there, that area right there is part of piriformis, but also part of glute max. And so for a lot of us, it's hard to distinguish which one's which. Mm-hmm. But if there's some soreness there, hold it, do some hip circles.
Okay.
And also, like, for example, if we go to those spines again, right here, if we go to our ischial tuberosity, which is that spot here, halfway in between here, oftentimes we'll find the piriformis. And that guy, and you can go out from there. So this way out, this way in, you can find a spot that hurts. If you want help to find your piriformis, I'm gonna stand up for a second here. There we go. And you can take your leg and you can externally rotate it. Whoa, we're looking at my balance right here. Not so great. So externally rotating means just put your foot out. And so here's my foot. There's no place like home. There's no place like home. Keep that in mind. And while you're doing that, come up here, each finger in the booty, no place like home. That piriformis is going to pop up under your finger. and it's going to say hello. Dig into it and see if you can find a spot that hurts.
Yeah.
If you find a spot that's sore, you're on the right spot. And we have different continuums because this muscle is a strappy muscle. It's about this long. And so Dr. Bree is going to show you. There you go. Excellent. She's got the perfect setup for this. So just like that. So you're doing the no place like home. Yeah. So that's going to be our next variation on the hip circles, the no place like home.
I like it. It's actually kind of, it's sort of jazzy right now. It's like a dance move.
Yeah.
Okay. I like it. Except
she's got the moves. Look at that. I love it.
What's the next one? I have a feeling we're honing in on the middle one, which I don't know if we can do some circles for that.
We'll find something. I think both between the two of us, we'll vibe something off of it for folks to have fun with it because it's a little more invasive, but whatever. Okay, so this next one is your coccygeus muscle. And so the coccygeus muscle is a little bit deeper in the glute there. It's a closer to what I call the crack area. And it's underneath a tendon called the sacrotuberous, not a tendon, a ligament, sacrotuberous ligament. And so you can kind of find it by finding the ligament first. So I'm going to move back a little. So hands on the butt like this, just to give yourself some orientation. And then you want to find the crack, kind of where the glute kind of starts to separate apart. So everybody, there's my crack. And then we find the, right there, right where our coccygeus muscle muscle bone kind of bends forward. And then we've got our ischial tuberosity, and that guy's there. Yep, that's where our hamstrings attach. So anyone who has had a hamstring injury, this is for you. So in between, you've got this tendon right here, and you'll feel it. It's a big, I keep calling it a tendon. It's a ligament. It's a big strappy guy. If you go just a little bit under it, kind of to the side of the crack, here's my crack, right here, going in, it would be on the inside kind of the ischial tuberosity. Yep, I'm pointing.
Yeah.
You've got it. So this guy here, get your fingers in there. I think you could do circles. I think we could do pelvic tilts. Pelvic tilts could be fun with this guy.
You know what you do? You know what you do? You do this. You grab in there and you lean forward. You pitch forward.
Yes. I love it.
And then you pelvic tilt. Yes. We got it.
I knew you'd have an answer for me.
That's really, really effective. That's really getting into the pelvic floor. This is very effective, people. I hope you're doing this.
You guys, you gotta try. It's not so bad. It's not too super invasive. It's not even that weird. It's just like you're just, when guys have a high hamstring strain on, national sports, you'll see them grab this area sometimes. It's nothing weird. So I like it. Bending forward, back up. Oh yeah. It's good.
It's really good.
I think this is it.
Yeah.
All right.
So it's almost like you're trying to separate your sitting bones apart is kind of what it feels like.
Absolutely.
Okay. Perfect.
So that's coccygeus, guys. Now, our last one, of course, I left for the most sort of awkward one, but it's the superficial transverse perineal muscle here. So we're going to it goes from the end of, it's literally going to go, it's going to go from the end of your labia. So kind of where your labia on the bottom connect. It's going to attach from the end of there, and it's going to go all the way over to your ischial tuberosities. So here I go again.
Yeah. Those are your tuberosities right there.
Mm-hmm.
So it's really going to be right in the middle of that, in the fleshy,
Yes.
Yeah.
And so the muscle's like two little guys. It's like this. They're like two little guide wires that go side by side, and they help to guide what's happening with the pelvic floor. And in fact, they're involved in urination. And so ladies, if you have any dribbling issues or can't do jump rope very long without having some malfunctions, doesn't matter if you've had kids or not, I'm calling myself out. These guys help. I actually have been doing them before I do some of my jump rope routines, just to kind of give them a little bit of love, and it seems to help with things there. So just something to put out there for the masses and see what's going on. So I'm going to bend this down a hair here, and I'm going to scoot back. So to find this guy, you actually have to get in there a little bit. So
we're just doing it. We're just doing it.
Get those legs open a little bit. Mm-hmm. So you want to go for the bottom of the labia, so where the labia come together. So right about here, and you want to find your ischial tuberosity. So creep around. There's my ischial tuberosity. Right in between here, you've got that muscle. That's where the transverse perineal is. It's a superficial transverse perineal because you can feel it. And it's often sore. Mm-hmm. Bike riders. Yeah. This is for you. That area that hurts when you ride a bike and it's sore, this is that muscle, I'm convinced. Mm-hmm. So if we find that muscle, you literally just put in a couple of fingers on either side right there, and you're just holding it. Okay. Yeah. I'm thinking, even you see I'm leaning forward here. I will sometimes do that. It's a nice wrist stretch as well. It's kind of the seal stretch for one of the seal stretches for the wrist. I like this.
But I think you could do a bit of a pelvic rock, like a little pelvic tilt, so that you're kind of strumming over the muscles and the tissues. A little pelvic, like anterior and posterior pelvic tilt.
I like it. I'm doing it right now.
Yeah. Yeah.
I like it. Yeah, this one's more invasive. Yes, it's kind of weird, but hey, you know what? The more you can get up in there and feel things and really get in touch with what's tight or what needs just a little love. This muscle doesn't need much. Yeah. It doesn't need much at all. In fact, you can just, like you were saying, strumming it and just kind of going back and forth. This is what I was doing with my fingers, guys, with the anterior and posterior pelvic tilt. Yeah. And it feels good. I like it. Yeah. Yep, just like that. Exactly. And I wonder even if a little bit of like this too.
Yeah. I think that would be really good. A little bit
of that. Just kind of depends on what works for you, what feels good. I think this is the one you got to use your fingers, a tennis ball, a golf ball. You need to feel that tissue because it feels like a little strap in there. And it's very identifiable. You'll know as soon as you touch it, it's a band. And here's the thing. In that area, you're not hurting anything by pressing your fingers into the perineum. It's not a big deal. You're fine in there. In fact, most of us need to do that a little bit more with some, it's not like we can go to a massage therapist and ask for this type of stuff. It's awkward. So it's things that you can do on your own. And I like this one. I think it's a game changer too. And so that is my series of acupressure for the pelvis. We went through all of it.
That was mind-blowing. If people are still watching till right now, you guys, you just got like $1 million session right there. That could do a lot for you, all of those points. And I will say, from my experience working with folks with pelvic pain, is you do less is more for, especially when you get into these more delicate areas. Less is more, less pressure, less time. Like I feel, you tell me so like when I do that psoas point or like my glute points, I feel like I can dig in there, I can get in there and I can really kind of feel that tenderness and it's good. But when I don't even have pelvic floor tension issues or pain issues, but when I work on those, like that last one you just showed us, it actually, if you go too hard and for too long, it can leave you with an aching, like a dull aching. And so be really careful if you're working on these points, that you're just doing less. You can always apply more pressure, but you can't, it's hard to like back off once you've gone too far, right?
Yes. I would agree. I would say maybe 10, 15 seconds and gentle and ease yourself in. I mean, maybe you could do eventually 30 seconds there, but I would say, get in there with the fingers and just kind of gently feel it. And that's why I said fingers. Don't use the other tools because you can't feel and you need that connection with yourself. And this is where you really want to breathe. Yeah. And work on some breathing techniques with the area. Because if you're back here and you've got your hands right in this area, maybe just lightly touch to start. And you're just kind of taking a deep breath in, 5-count inhale, 7-count exhale. A lot of times what you'll feel is that your fingers will gently sink into your tissue on their own with the breath work. And maybe that's what you need, just a little bit of work there. And you might be thinking to yourself, well, why would I even want to touch that area if it's inflamed? Here's the thing. It helps to have the connection to yourself.
Mm-hmm.
And that breath, by connecting your breath to holding that area, I found some really great results happen by just connecting the breath there, because there's so much in our pelvises as women that we hold, from disappointments to trauma to all kinds of things. And sometimes just being able to make that connection between your brain and parasympathetic nervous system to be like, let's chill a little.
Absolutely.
Let's just breathe and just support the muscle where it is.
Yeah, that is so good. And I actually just did an interview with Dr. Amruta, which will be on my YouTube channel as well. She was talking about breathing and the pelvic floor and how that connection is with the breathing diaphragm and the pelvic floor. And really all you need to do is just get the breathing diaphragm moving, because sometimes when you're locked up in the pelvic floor, you're locked up in the diaphragm as well. But when you work on getting that diaphragm moving, it naturally starts getting the pelvic floor moving too. So I think that's what you're speaking to right there.
Absolutely. Absolutely. Yeah. I would combine, I mean, like I mentioned in the beginning here, breathing with this, because it's so huge.
Yeah.
There's such a connection between diaphragm and pelvic floor, for sure.
This has been, like I just said, invaluable. This is so helpful. Thank you so much, Dr. Jannine. I am very grateful that you came on and showed us all of these, kind of crazy positions, but I think that we really came up with something good that will help people. So thank you. What would you leave my folks with? Any parting words of advice or wisdom when it comes to pelvic health and acupressure?
Yeah, I would say just play with it. Just try it. If it seems like the whole process is too much, great. Find the spot that's just exquisitely tender and do some pressure with that, do some breathing with that, and do some hip circles with it if it's appropriate. I think just start, slow and just one step at a time. And you can work it into a whole routine if you want, but take what works best for you, make it your own, and thrive. That's what I'd say.
That's awesome. I love it. I love it. I love talking to you. And so how can people find you if they want to connect further?
So you can find me at drjkrauseND.com. That's my main website. I'm also a podcaster too. And so you can check me out at thehealthfixpodcast.com or the Health Fix Podcast, anywhere you find podcasts. And then Instagram, I'm starting to get more active on Instagram, Dr. Jannine Krause, JANNINE KRAUSE. Going to be putting out some more videos, especially some of my pelvic floor acupressure stuff, and looking forward to seeing everybody on there. And give me some feedback. Let me know what you want to see.
Yay! Awesome. I'll put everything in the show notes, the video notes, so people can check that out. And thank you so much. It's a pleasure every single time, and we'll be in touch more soon. So thank you again. Bye.
Bye.